You know, if you've got an older dog, chances are you've heard your vet mention a heart murmur. It's super common, right? But that little sound, it can be the first whisper of a much bigger problem. Today, we're diving into a landmark study that totally changed the game, finding a way to give these dogs more healthy, happy years with their families.
So, for a lot of us dog owners, hearing heart murmur is, well, it's a familiar moment, but it's still a little unsettling. Most of the time, it's just a wait-and-see situation. You know the drill. Your vet says something like, all right, let's just keep an eye on it for now.
But that's the big question, right? When does that kind of innocent little sound turn into a ticking clock? When does it signal the real start of heart failure? Forever, really, the standard advice was just to wait for symptoms to show up. But what if waiting was actually the worst thing we could do?
All right, so let's break this down. To really get why this study was such a breakthrough, we first have to understand the disease itself. And it's a sneaky one. It's this silent progression happening inside a dog's chest way before we ever see a single outward sign.
The condition has a pretty long name, myxomatous mitral valve disease, or just MMVD for short. Now just think of the mitral valve as a perfect little one-way door inside the heart. With MMVD, that door starts to get kind of weak and floppy, so it doesn't close all the way. That means blood starts leaking backward, and the heart, well, it has to work harder and harder and harder just to do its job.
And this is how it usually goes. First, you get that leaky valve, which is what causes the murmur your vet hears. Then, to try and make up for it, the heart muscle actually starts to stretch and get bigger. But eventually, it just can't compensate anymore. That's when the dog goes into what's called congestive heart failure, or CHF, and fluid starts backing up into the lung.
So, for years and years, vets just followed that watch-and-wait playbook. They'd only start treatment once the dog was already in that final stage, once the symptoms were obvious. But then, a group of researchers came along and asked a really revolutionary question. What if we didn't have to wait? What if we could step in before it ever got that bad? And that question led to what's known as the EPIC study. The goal here was, well, it was simple in concept, but absolutely massive in scale. They wanted to take dogs that were right in that middle stage. You know, they had the murmur, their heart was already getting bigger, but they seemed totally fine on the outside, no symptoms at all, and see if a specific medication, Pimobendan, could actually delay the start of heart failure.
Now, to get a real, reliable answer to a question like this, you can't just give every dog the pill and cross your fingers. No way. You need a super rigorous scientific test to prove that any effects you see are really from the drug and not just some random coincidence. And this is how they built a truly rock-solid study. They used what's called the gold standard in medical research, a randomized, double-blind, placebo-controlled trial. So they took over 350 dogs and randomly split them into two groups. One group got the real drug, Pimobendan. The other group got a placebo, basically a sugar pill that looked exactly the same. And here's the really important part. Nobody, not the owners, not even the vets, knew which pill each dog was getting. This is how you eliminate bias and get results you can truly trust.
And you know what? The researchers did not have to wait very long to see if it was working. In fact, the first really stunning signs of a major breakthrough showed up in just 35 days.
Okay, so what you're looking at here is pretty remarkable. These charts show the change in heart size. See those boxes for the Pimobendan group? They're almost all below that zero line. What does that mean? It means the hearts of the dogs getting the real drug were actually physically getting smaller. The medication was literally reversing that dangerous enlargement. The proof was right there, and it was undeniable.
So the drug makes the heart smaller. That's a really cool scientific finding, for sure. But what does that actually mean for the dog curled up on your couch? What's the real-world impact?
Well, this is the beautiful part. The study proved a direct link, a clear cause and effect. By making the heart smaller, the drug eased the strain on it. And that directly translated into a longer, healthier, symptom-free life. It was literally pushing back the clock on heart failure.
But, and this is a really important point that shows the study's honesty, Pimobendan isn't a cure. The disease does keep progressing. This quote from the study is key. It says that when a dog on the medication did eventually go into heart failure, they looked just the same as a dog who'd been on the placebo. So the drug's true magic, its incredible power, is in its ability to delay that inevitable moment, not stop it from ever happening.
The results from this study were so clear, so profound, that they didn't just add a new chapter to our understanding. No, they completely rewrote the entire rulebook for how vets treat this incredibly common heart disease.
So what did all this time, all this research, actually buy these dogs and their families? The answer? is 15 months. On average, an extra 15 months of good, quality, happy, symptom-free life. That's a year and a quarter. I mean, for a little dog whose whole lifespan isn't that long to begin with, that is an absolutely enormous gift of time. That one number, it changed everything.
And just like that, the old watch and wait idea was thrown out the window. Because of the EPIC study, the new standard of care all around the world is to find these dogs with an enlarged heart and start treatment proactively. We don't wait for the first cough, we don't wait for the first sign of trouble, we act.
And that really leaves you with a powerful thought, doesn't it? This was a disease that was basically hiding in plain sight, a silent problem we all just waited for. The EPIC study proved just how powerful proactive medicine can be, and it really makes you wonder, what other conditions are out there that we're just waiting on?